This is the procedure for blood draws from midline catheters. After you gather your supplies, perform hand hygiene and don appropriate personal protective equipment. Confirm the patient's identity per policy 2018. Provide education to the patient and/or family on the procedure. If infusions are currently running, disconnect them from the midline catheter. Scrub the access cap with 70% alcohol swab for 15 seconds. Allow to air dry, and then flush the midline catheter per provider order. Once you flush the line, clamp the extension tubing. If drawing blood with a syringe, place a sterile 10 milliliter syringe onto the access cap of the midline catheter and pull back slowly on your syringe to draw at least 3 milliliters of waste blood and discard in an appropriate container. Then attach another 10 milliliter syringe onto the midline and withdraw the needed amount of blood for ordered testing. Attach a vacutainer to this syringe to transfer the blood into the appropriate blood tubes per order of drawer. If drawing blood with a vacutainer, after you've already swabbed the cap for 15 seconds, allowed to air dry, and then flush the midline, you will ensure the access cap is below the level of the insertion site. Screw the vacutainer onto the access cap of the midline catheter. Draw a 3 milliliter waste tube first and discard in appropriate container. Then place the appropriate lab tubes in the vacutainer, one at a time, per order of drawer, until all appropriate labs are drawn. Remove the vacutainer from the access cap on the midline catheter. Regardless of which method you use, when you are done, you will then scrub the midline infusion cap again with 70% alcohol wipe for 15 seconds. Allow to air dry, and then flush the midline catheter per provider order. Ensure that you clamp the extension set prior to removing syringe to maintain positive pressure. Label blood specimens per policy and send to lab promptly. If the midline catheter does not have blood return on attempted blood draw, you can try these maneuvers. Ensure there is no kinking in the extension set or catheter. Untape the extension set and straighten it out while slowly pulling back on the syringe. Ensure proper patient positioning, i.e. sitting or recumbent positions. Place the arm away from the body, either out straight or positioned upwards. Attempt blood aspiration with a smaller syringe, i.e. a 3 milliliter syringe. Have the patient turn their head away from the arm the midline catheter is placed in while attempting the blood draw. If none of these things help, you can consult the IV resource